Have you ever imagined a world where a new and dangerous virus is rapidly spreading? A virus that can cause a painful rash, fever, and other serious symptoms. A virus that the World Health Organization has declared a public health emergency of international concern. Could this be the world we are living in today with the monkeypox outbreak? Is monkeypox a rare but serious viral illness that can be transmitted from animals to humans or from person to person? Yes, monkeypox is indeed a rare but serious viral illness that can be transmitted both from animals to humans and from person to person. And is it true that the virus is most commonly found in Central and West Africa, yet cases have now been reported in over 100 countries around the world? Absolutely. The virus is predominantly found in Central and West Africa, but it has made its way to over 100 countries worldwide. Now let's delve into its symptoms. Do the symptoms of monkeypox typically begin 14 days after exposure to the virus? Yes, the symptoms usually manifest 14 days after exposure to the virus. And do these symptoms include fever, headache, muscle aches, backache, swollen lymph nodes, and a rash? That's correct. Monkeypox symptoms encompass fever, headache, muscle aches, backache, swollen lymph nodes, and a rash. Isn't it interesting that the rash usually starts on the face and then spreads to other parts of the body, often resembling pimples or blisters? Can it be very painful? Indeed, the rash typically begins on the face and then spreads, often looking like pimples or blisters, and it can be quite painful. Here's something to ponder. Most people recover from monkeypox within a few weeks. But did you know that the virus can be serious for some people, especially young children and individuals with weakened immune systems? Absolutely. Most individuals do recover within a few weeks, but the virus can be quite serious, particularly for young children and those with weakened immune systems. It's a fact that there is no specific treatment for monkeypox, but is it true that the virus can be treated with supportive care, including medications to relieve fever and pain? Correct. While there's no specific treatment for monkeypox, supportive care, including medications to alleviate fever and pain, can be administered. How can you best protect yourself from monkeypox? The answer is simple. Avoid contact with the virus. Does this mean staying away from infected animals and people and avoiding contact with contaminated materials? Yes, the key to protecting yourself from monkeypox is indeed to avoid contact with the virus. This involves steering clear of infected animals and individuals and refraining from contact with contaminated materials. Are there specific steps you can take? Should you wash your hands often with soap and water? Yes, one essential step is to wash your hands frequently with soap and water. Is it recommended to avoid close contact with people who are sick? What about avoiding contact with wild animals and their remains? And if you happen to have a rash, should you cover it with clothing and avoid touching others? You should indeed avoid close contact with individuals who are sick, as well as refrain from contact with wild animals and their remains. If you have a rash, it's advisable to cover it with clothing and avoid touching others. Now let's imagine these scenarios. In a hospital in London, is there a young man lying in bed with a painful rash all over his body? And did you know he's one of hundreds of people in the UK who have been infected with the monkeypox virus? Yes, in a hospital in London, there's indeed a young man suffering from a painful rash. Astonishingly, he's one of many people in the UK infected with the monkeypox virus. What about a village in Central Africa? Is it possible that a woman and her 2 children are quarantined in their home after being exposed to monkeypox from a wild animal? And even though she's concerned about her children, does she know they are safer in quarantine than out in the community? Absolutely. In a village in Central Africa, a woman and her 2 children are quarantined in their home due to exposure to monkeypox from a wild animal. Although she's understandably concerned about her children, she recognizes that they are safer in quarantine than in the community. Shifting gears, can you envision a laboratory in the United States? Is it true that scientists are working tirelessly to develop a vaccine against the monkeypox virus? And isn't it clear that time is of the essence as the virus continues to spread around the world? Indeed, scientists in a US laboratory are dedicatedly working on developing a vaccine against the monkeypox virus, recognizing the urgency as the virus continues its global spread. In closing, it's crucial to understand that the monkeypox outbreak is indeed a serious public health threat. But here's the positive note. There are steps you can take to protect yourself and your loved ones. By following the tips we've discussed in this video, you can play a vital role in slowing the spread of the virus and keeping yourself safe during these challenging times. To dig deeper, let's explore how monkeypox is transmitted. Can it be transmitted from animals to humans through contact with an infected animal's blood, bodily fluids, or lesions? And can it also be transmitted from person to person through contact with an infected person's skin lesions, bodily fluids, or respiratory droplets? That's correct. Monkeypox can be transmitted from animals to humans through contact with infected animal materials, and also from person to person through various means. Do you know that anyone can get monkeypox, but certain individuals are at higher risk, like those who have close contact with infected animals or people with weakened immune systems, and young children? Absolutely, anyone is susceptible to monkeypox, but some, such as those in close contact with infected sources, individuals with weakened immune systems, and young children are at higher risk. You may wonder, is there a specific treatment for monkeypox? But it's a fact that there's no specific treatment. Nevertheless, the virus can be treated with supportive care, including medications to relieve fever and pain. True, there's no specific treatment, but supportive care can effectively address the virus's symptoms. Remember, the monkeypox outbreak is a serious public health threat, but there are actionable steps we can take to protect ourselves and our loved ones. By following the tips provided in this video, you can help slow the spread of the virus and stay safe during these challenging times.